I stop sharing and I'll get on to the proceedings. So we are truly grateful and we are extremely happy to have Professor Shamika Ravi today. And as you know that today's topic is really important for us. In fact, in 2018, I remember November, Professor Patrick French invited Professor Shamika Ravi to talk about her one of the papers in 2012 that she wrote, and the paper was Women Voters in Indian Democracy: A Silent Revolution. And that talk was really interesting. And after that, we have been waiting uh, for her to invite, and recent elections have given us this chance to host this conversation series webinar on this topic. Just to give a quick intro, though we all know, we all follow her on Twitter, and we have been really fortunate to get a great insight about pandemic on her Twitter feed. But just to give you a quick intro, Professor Shamika Ravi is a non-resident senior fellow of the Governance Studies program at the Brookings Institution, Washington, D.C. She was the former director of research at Brookings India, and her research focuses on economics of development, including areas of finance, health, urbanization, and gender equality. She's also a visiting professor of economics at the BITS School of Management and the Indian School of Business, where she teaches courses in managerial economics and microfinance. She was also a member of the Economic Advisory Council to the Prime Minister of India, and she writes widely in popular newspapers of Hindi and English, and we all know her. So thank you so much for joining us, Professor Shamika Ravi. It is our pleasure. Uh, the in-house professor who will be in conversation with Professor Shamika Ravi is Professor Patrick French. He is the inaugural dean of the School of Arts and Sciences at Ahmedabad University, and he also holds an additional position as professor for the public understanding of the humanities, advocating for their importance in a well-rounded education. His books have been translated into several languages, and he has won several awards, including Hawthorne Prize, the Royal Society of Literature W.H. Hinman Prize, and the U.S. National Book Critics Award, and the Somerset Maugham Award for the Sunday Times, and the Sunday Times Young Writer of the Year Award. He is presently writing the authorized biography of the novelist Doris Lessing, following a competitive process of appointment. Much of his work has focused on political and social analysis of India in the decades directly before and after independence in 1947 and the period following economic liberalization in the 1990s. And he has written about Indian election, knows Indian politics and particularly South Asia really well. So he's the best person to be in conversation. So we are thankful to you, Professor French. Before I hand it over to you, there are certain rules. So as we know that except both the speakers, everybody will be muted. And we would request you to put your questions in the everybody chat box. We'll curate those questions. And when the conversation ends somewhere, let's say around 5:55, then we'll take the questions and both the speakers would answer those questions. So thank you so much for doing this. And now I request you to take it forward, Professor.
Great. Thank you very much, Sudhir, and all my other colleagues in the Amrit Modi School of Management who've kindly invited me to chair or present this conversation with Dr. Shamika Ravi today. And I know that there are quite a few economics faculty who are here from Ahmedabad University. And I'm going to take advantage of the fact that my background is in the humanities as a biographer and historian to ask the dumb questions about economics that I hope will elucidate some things that puzzle the rest of us. I've had a couple of previous conversations with Shamika, Dr. Ravi, in the past. Once, as Sudhir mentioned, when she was visiting Ahmedabad University, but even before that, when we were just in the process of setting up School of Arts and Sciences, we had a very interesting discussion about what sort of education, what sort of research is needed in India, and how can we help to contribute to that at a new private non-profit university with a kind of social intention attached. And that advice was very helpful to me. We also did a podcast, which I listened to again, which reminded me of some points that I thought it might be good to even refer to again in today's discussion. I think one of the things that I noticed, Shamika, about your own career trajectory, and I'm sort of speaking slightly as a biographer here, is that you went to LSR, then to Delhi School of Economics, then to NYU, then back to teach at Indian School of Business, and you're now very much in the realm of public policy, You are a VEP at the Observer Research Foundation. You publish a lot. You do a lot of public activity. You're also in other areas like autism awareness. You're somebody who's very much in the public sphere. And I'm just interested really about sort of why you stuck only with economics at an academic level when you were doing your bachelor's, master's, PhD, and why you then diversified more recently into public policy in your career rather than being a hardcore academic.
Oh, Patrick, thank you for the question. It's really a pity that I stuck to economics for almost all my formal education and training. And a large part of it, I must say, was because of that's what was offered in India 25, 30 years back when I finished schooling and I entered the university system. Though I must say I was very fortunate to go to some of these excellent institutions. LSR, Lady Shriram College. I remember I was into politics. We raised a lot of funds. I was into dance and drama. I remember many things. In fact, the only things I don't remember very well is the economics curriculum. I must be very honest with you. But that is what undergraduate education to a large extent in the university system 30 years back, was typically. Delhi School, I think, was the first introduction I had to what a career in research would look like. So I was very fortunate to be trained by some excellent faculty. But it was truly only at NYU, Patrick, that I realized I totally fell in love with economics. The fact that most of my classmates were mathematicians or physicists or from engineering backgrounds was in the beginning a bit of a challenge because you felt you were falling behind in the quantitative or the technical. Economics has increasingly become more and more math. In fact, as Remark calls it, the mathiness of it all has truly overwhelmed us. But the training is very important. I think the methodological rigor that we bring to the table in answering questions which are very contemporary and frankly something we all grapple with, whether it's the gender problem, it's the quality of education, mental health. These are problems that we live with in India. So the motivations aren't esoteric, they aren't remote, they're very much parts of our lives. If you live in India, you can't possibly neglect a lot of these things. The magnitude and the severity of these problems are quite hard-hitting. So the problems and the motivations are something we all share, but I think what we bring to the table as economists are really the methodological rigor and a certain spectrum within which we are in a position to analyze data and try and tease out, try and test some of the hypotheses and make sense of as objective as possible. Controlling for many things. I think that has largely been the way my interest has swayed. The first 10 years after my PhD were really only in the development finance area. So I looked mostly at microfinance and impact investing space. But that has a very strong gender component. And South Asia is a hub for it. There's been so much experimentation in Bangladesh and southern part of India that you learned a lot. I mean, we learned a great deal simply by experimenting on the ground and through various institutions. But the last 10 years, I think, and 8 years in particular, my focus has shifted much more on human capital, which is education and healthcare. And healthcare, frankly, I'm interested in any aspect of healthcare that I get my hands, the data access to. So whether it's the financing of it, so Ayushman Bharat, and who's going to fund it in the long run, and is it sustainable? Two problems of what is the incidence and magnitude of some aspects of health problems in India. How big is mental health? It is a taboo, so we don't typically measure it very well. But also just disease burdens. What are typical households, what are typical citizens living with when it comes to healthcare? Making human capital much more mainstream in economics is truly my current passion, focus.
Okay, so before we go on to the main topic of the seminar, a unique case of silent voters, the missing women in Indian democracy, let's stick for a little while with economics as an academic discipline. Now, I think that economics is one of those areas, a bit like education, that everybody has an opinion about it, whether or not they work in the field. And, again, as somebody whose training is not in economics, but who is interested in it and quite often will interact with economists, some of the questions that come up are, why is it that if you read the sort of founding figures in economics, if you want to read Adam Smith or you want to read Karl Marx, you don't really need any econometric training. You can happily just sort of pick it up and read it. Whereas today, if I pick up an economics paper, very often I'm sort of unable to access it because of the jargon or the methodology or the mathiness or just the way that it's written. So that would be one critique. Another critique, I think, would be, this was famously asked at the LSE by Queen Elizabeth II to a group of economists. Why did you not see the financial crisis coming? Why did your models not predict it in, what would it be, 2008? Which is, a very interesting question. If you've got this discipline and all these exceptionally skilled people trained within it, why does the global economy do the things that it does? Are there faults in the way that economics is understood and taught? Is there too much emphasis on the teaching of neoclassical economics? Why did it take so long for behavioral economics to break through? We all know that we don't make rational choices every day. So why within economics did that take such a long time to break through? And then finally, the key question, which you're super qualified to talk about, economics and gender. And just to take one data point, the lack of women winners of the Nobel in economics. The number was doubled when Esther Duflo got the Nobel a couple of years ago. And she's somebody, of course, who's worked on India a lot. She's in that small and highly elite subset of people who are OCIs, overseas citizens of India, but not of Indian origin. And, in a way, she has also addressed this. But, I don't know which of those various approaches or critiques you'd like to take on. But I do think that it seems to be quite often that, with economics, as with education, people always want their questions about it to be answered, and they want their version of it to be accepted. So that's really what my question is coming out of.
I think all the critiques, Patrick, are well taken. I completely appreciate, and I want to re-emphasize a lot of these. There is a fundamental problem with the way we are training in economics. I think while math is really just a language, it's a tool. It's not the core of economic, logic, economic reasoning, and therefore it has become much more esoteric and difficult, I think, for people to understand, but very importantly for economists ourselves. We very often, and I went to NYU for my PhD training, and many of us, we were trained in structural thinking. So you really developed complex structural models, and then you worked the reduced form and you took it to the data to finally make sense of it, because structural models are very difficult to apply to a lot of the real world, and it is very challenging. But I must say that we do need more generalists. I think it's a shame that we don't teach economic history, economic thought. We don't have more political economy in the way we teach things. And I think those are course corrections which I think the field is already beginning to address. And behavioral is definitely one of the biggest developments which are meant to address some of this, this narrowness of approach which we have struggled with. Behavioral economics, however, is also not a panacea. It is still a developing field, and sometimes, and though I have, been working in different aspects of behavioral economics, but behavioral also deals with peculiarities. I think there are general aspects to behavioral economics, but sometimes, particularly in the policy space, the problem might be very much a cost issue, might be a lack of awareness issue. So it very much falls within the realm of traditional neoclassical. So it's a cost issue, just affordability issue. And while we might be thinking of innovative new behavioral solutions, sometimes the elephant in the room is just make it more accessible or more affordable. So I think we cannot lose sight again of the general sort of approach and the realism and the pragmatism, which I think policy world demands of economists. And I think that is where for some of us who try and straddle and try and balance academic rigor with policy application. I hate it when I'm not in a position to explain something to a policymaker in very simple English, because that is really a failure on my behalf and our, as economists. So I think pragmatism for solutions to be truly implementable. I think non-implementable, however cool and sexy the idea might be, but if it's not implementable, it's just really a bad idea, given the context that we work on. And the final aspect of the criticism, which is gender, the kind of inequality that we live with, Patrick, that's while it is a general problem for many social sciences, but in economics, it continues to be a very, very severe problem. I think there are entry barriers, not just getting into economics as a field, but also sustaining it. The tenure system.
Is it getting better? I mean, have you seen improvements in the last 5-10 years?
There is great awareness. So now we are measuring, and we are trying to measure what was earlier pushed aside as a capability issue. Now we're trying to measure whether the opportunities indeed are equal, or are the costs disproportionate, because we are against odds. To nature, for instance, the tenure track really coincides with the time when, if you care and you want to have a family and children, it sort of coincides with that. And the costs are very disproportionate, and not accepting some of those real costs that women go through is a bit of a shame, but it's beginning to get addressed, very slowly still, but definitely the awareness of this problem is growing every day.
Thank you. So you mentioned economic history, so let's sort of use that as a kind of lead into the present. So if you go back 50, 60 years and you look at per capita GDP in India as against, let's say, China, South Korea, they're all much of a muchness, and that's no longer the case. There were major macro reforms in the 90s to 2000s, but I remember when we last spoke, you said that you don't think it's about macroeconomic reform at this point if you want to transform the Indian economy in the ways it needs to be transformed. It's more about second-order reforms. And I think, as you alluded to earlier, you were talking about, in particular, education, health, and gender. Is that happening in the way that you think it should be happening? Have you changed your view at all that there may be larger structural reforms also that need to be considered?
Well, one is we're in the midst of a pandemic still, and that has definitely brought about a course correction in the way we have traditionally viewed health sector. Health has often been the non-cool part of governance. Most smart bureaucrats, whether it's at the center or at the state, have traditionally wanted to be at powers of centers, which are, the finance and defense and so on and so forth. Health has often been a social issue, a social subject, which doesn't demand the same respect. And yet the pandemic has clearly changed that. The pandemic has brought about a tectonic shift in the way we view healthcare as being part of, core economy. Because again, one data point which I do want to share is that given the lives lost per capita or per, let's say, 100,000 population, we have relatively fewer of it. But the economic loss, if you consider the nature of the lockdown compared to European countries or many parts of Latin America, etc., our economic loss was much higher in the first 6 months. And why we had to go in for a preemptive lockdown when our numbers were well within 500 cases is really a reflection of the opportunity cost of not investing in healthcare. That if we did have the public health wherewithal, the infrastructure and the capacity to withstand this kind of a shock, we would have continued with economic activities, perhaps at a lower level. But this complete clampdown almost became essential because our public health infrastructure, or let's just say healthcare infrastructure in general, is not or wasn't strong enough to withstand this kind of a shock. So we had to go in for a preemptive shock. So healthcare has real implications.
But to be clear on the lockdown, you see that as being essential because of limitations in public healthcare, or do you think it was something that was done but didn't necessarily achieve what it was meant to?
Well, if you compare the subsequent waves, Patrick, then definitely we flattened the curve, meaning it took us 6 months to peak, and then the first wave was fairly muted in India. And largely thanks to the national lockdown, which was very severe. But the only way to make sense of it is that, look, the loss of, economic loss that we suffered is really the opportunity cost of not having good health infrastructure. As most of Europe, many parts of the world went back to business as usual. Once the initial, let's say 1 or 2 months, unlike us, we had a very elongated phase of unlocking, simply because we just didn't have the capacity in healthcare.
And in terms of reforms that have either happened recently or you think are likely to happen soon, what are the ones around human capital that, if you like, you've been pushing for, hoping for, and you think may be implemented?
One is, I think we need to continue with the health reforms. There has been a big move as far as Ayushman Bharat is concerned, because it is a significant step towards universal healthcare or affordable healthcare. But we need, and the new education policy is definitely a big jump as far as the education policy, if it is concerned. But beyond that, I think a lot more needs to be done in gender. We have to make gender very much a central part of a lot of our policy making across different sectors, because gender is not limited to WCD as a ministry, but just like health, it affects, it's like climate, it affects various different aspects of governance. But again, the point to note here, and this is where I think academic clarity and academic sort of recommendations often come to clash with ground realities, and the political economy of it is fairly uncertain and in many cases unclear. The farm laws, I think, gave us sort of a rude shock, because for 40 years we've had economists across political spectrum ask for these set of reforms, and yet we saw that however progressive it might be as an idea, these ideas need to be sold, they need to be communicated, and I think that is where good ideas can often fail when we're trying to implement them on the ground.
So on the question of healthcare and gender, you recently published or co-published a paper on BMJ Open, the sort of open source version of the what used to be the British Medical Journal. And you were talking there about access to healthcare at AIIMS Delhi, and the way that it was really skewed in terms of gender ratios of women's access to that form of public healthcare. You took a very large sample set of, I think, close to 2.4 million visits, which is really, really substantial. And you also looked at which Indian states people came from, in other words, what distance they had to cover. And you made some qualifications at the end, which was about whether people were registered, I think, where they were from, which I know is an issue at AIIMS, that people will often put a Delhi address if any family member has a Delhi address and so on. But can you broadly outline what your learnings were from that research?
Well, AIIMS is the largest public hospital in Asia, and it gets a footfall which is almost like a combined and more of almost all district hospitals across. It is our apex.
Can I just interject? If it's the largest public hospital in Asia, does that mean it's the largest public hospital in the world also?
Well, we don't know the numbers for Africa and Latin America, or for that matter, we don't have data from Russia. So, Asia is what we have the data for, which is where I'm sort of limiting my assertion. But AIIMS is a universe in itself, Patrick, and the complexity of cases and just the fact that it's a public hospital, so the cost is not so much in terms of the actual care. The cost per visit or per hospitalization is very reasonable because it's highly subsidized. What we found, and again, for the economists in the room and for those of you who are interested in data, over the last 5-6 years, we have been part of a group of extremely driven young doctors who have helped digitize the entire data set of AIMS. So it's a huge gold mine of incredible data set. And this particular paper that Patrick is referring to, this was co-authored with the director, this is several years back, who's now the director, Dr. Randeep Guleria, Dr. Ambuj Roy, Deepak Agarwal, Mudit Kapoor at ISI, etc. So whenever we do health research, there are so many aspects of it that it typically becomes a very large collaborative exercise, and we all learn a great deal. But again, what we bring to the table is the methodological rigor. And it was quite intriguing that the sex ratio, or if you look at the skewness of patients coming to the AIMS OPD, it is shocking. We estimated that almost 50%, about 49, almost 50% of female patients are missing. Now, these are not departments of obstetrics and gynecology. These are all the other departments, which means that it's not a money issue because access is the same for men and women. The protocols aren't necessarily very different. So it doesn't take you longer for women to get registered, etc. It really is much more a demand side story, that fewer women are being brought into the hospital. So it's not cost, but just the kind of discrimination that society at large practices. And also there is a systematic age component to it. In fact, the only people who are brought into the hospital are women of the childbearing age. Children younger than 18 and above 50, almost entirely, very, very few instances. So it's about the nature of discrimination. One is the magnitude itself, that a very large number of female patients are indeed missing. And it is not a cost story because these are highly subsidized. The cost could be in terms of distance, and we do see that closer the locality, meaning closer the state, the higher the probability of people accessing AIMS. But remember, AIMS gets patients all the way from Himachal to Assam. Unlike other parts of the country, the northern Gangetic, this entire plain, AIMS truly is that apex public health facility where everyone ends up when you're in sort of dire situation. And
so just another intervention. So I mean, it wouldn't be likely or possible that the women would go to the more local bits of AIMS, that they would go to Jodhpur, Patna, Gorakhpur AIMS in greater proportions?
Well, first of all, if that were the case, then these are mostly referral cases, Patrick, which means that they have been somewhere else and they are now being referred to AIMS. So clearly they have all been somewhere before they approach AIMS. That is how difficult it is eventually to get to AIMS. But I think the sex ratio of the patients is more an indication of the kind of neglect women in general, and especially women who are not of the childbearing age. So older women and younger girls face in the society. So it really is just an estimate of what discrimination in society looks like. Now, this has actually, again, got bearing on larger public health policies, that there are many things the government can do. But for instance, making healthcare free. In this case, AIMS is practically free. It is extremely affordable. So it is not a money issue. It has to go beyond what governments can do. And I think it needs highlighting here that there is a role for the community and the family. That when it gets to, when we're talking about access to healthcare for women, there are also limits to what governments can do. There is a significant role for community and families. So we really do need to bring more women into hospital system and give them the access to care. Now, the NSS data over time is showing that women are likely, typically women underreport healthcare needs in India. This is actually completely contrary to what we find in the richer parts of the world. In richer countries, women have a higher incidence of reporting ailments. Women tend to use facilities more and so on and so forth. But in India, it's exactly the reverse. And the AIMS study clearly shows that it's more a measure of neglect in the society at large.
just to read out a note in the chat box from Sudhir, Gorakhpur AIMS is still developing, and BRD Medical College is the one that gets people from Nepal and other remote areas. I mean, another thing that did occur to me about OPD access at AIMS is that very often men will, particularly younger men, will be accompanied by women. So it will be a case of the man coming for the treatment with often an older woman being the person sort of in support of the male patient. That would be my sort of anecdotal observation. Which,
and by the way, that is it is mirrored. It is mirrored in many aspects of healthcare. In fact, we have a forthcoming paper which measures mental disability, and the kind of underreporting we have of mental health problems, again, around the marriageable age. So there is in nature, generally, when it comes to autism, etc., boys are much more likely to show symptoms and get diagnosis. But, the census data, first of all, the census data, if you look at the global burden of diseases studies, we have 50 million people who have some form of mental disability in India. But there is a systematic gender and age component to it, which very much mirrors AIMS kind of a story, that around marriageable age, people don't report. People don't want to address these issues. And that obviously leads to all kinds of complications. Then another study which basically looks at organ transplants. In fact, 80% of recipients are male, and more than 85% donors are women.
Right.
So there are obvious, arrangements and discrimination and neglect and expectations, I think, within the society, which have, led to these kind of distortions, and women's access to care is therefore far from equal.
And there's another paper that you wrote recently, published in the Indian Journal of Human Development, and this is about the Bihar Assembly elections that happened in 2020. And you used what you described as methodological novelty. Would you like to just describe that?
Well, I think it's interesting because, when we wrote the Silent Revolution paper 10 years back, that was a novelty in the sense, I think some of the best research, personally what I found extremely fascinating, are just simple time trends, and not looking at essentially what are the big driving factors around it, but just lay of the land. And I think that is where the Silent Revolution paper was fascinating, because consistently across constituencies, assembly and parliament, state after state showed that more and more women voters were participating. And then, of course, when you start looking at what are the factors that might be leading to it, there is no real policy intervention. It's not like the Election Commission is going and extolling women voters, particularly to come out and vote. Of course, it has gotten a lot safer. The EVM has made it more difficult to capture both better roads, more policing from outside state. All of these things mean that it has become safer for women to participate. But the trend that we have noticed consistently is from the 1950s and up until 2022. So number one, just rising female voters is now a very well, when we wrote this 10 years back, it was a novelty then, but I'm glad today it's part of the common sort of language. We accept that women voters have indeed come out, and there's a huge surge. But whether it has an impact is what I think Bihar has repeatedly given us natural experiment. The 2005 study, because in Bihar in 2005, February, there was an election and no party won majority. So basically president's rule was imposed, and after 6 months, there was a re-election. That becomes a natural experiment because there's no new policy in between. And what you see is in close to 36% of the constituencies, the results turned between February and October. And a large part of that turn in outcome is due to change or surge of female voters in those areas. Of course, when you take it back to data, you realize that these were women who came out to vote the RJD out and bring Nitish in. So 2005, Nitish was brought into government by women voters of Bihar. Now, of course, when we do the analysis and when we do all this sophisticated econometric sort of crunching, we learn this, but I must say, the politicians have their ears to the ground, so they know these things. Sometimes what they have a hunch on is what we are testing through larger data and systematic sort of analysis. And we found sort of similar trends in the recent elections of 2020. Mm-hmm. Now, the 2020 elections become particularly fascinating because this is 6 months, this is 4 months after the national lockdown. Now, the national lockdown was very stringent. There was a mass movement of migrant laborers back from the cities and the urban, more industrialized western part of India to the eastern parts. And Bihar is one of the largest sort of suppliers of migrant labor. So when all these people went back, and against the hardship that we saw being picked up on popular media, etc., the Bihar elections of 2020 became more like a litmus test that people have been through very difficult times. So let's see how they're going to vote. Almost all exit polls predicted a defeat for the NDA. And yet, when the elections came out, surprise, surprise, the novelty that we, I think, bring in terms of our analysis, Patrick, is that we marry the Election Commission data, which is the ECI data at constituency level, so gender and other things, with poverty data. So we look at poverty from the asset ownership index that the National Family Health Survey allows us to make at district level. So we have a good data for what is a measure of poverty at a district level. And then we combine that with the Election Commission to see what is the impact of poverty on election outcomes. And very systematically, we found that the poorer the constituency, the higher the likelihood of them voting for the NDA. Now, of course, this is where women, gender is a very strong factor, and particularly after the last study from Bihar, we were more mindful that we need to control for women. So we do control for women voters. And we find that having control for women voters, poverty is truly the driving factor. So that was number one. But then it's only when we do a disaggregated analysis of NDA and MBA, the Mahagathbandhan, and the National Democratic Alliance, which is the BJP and the JDU, but there were also smaller other parties, that we see that women still stuck to JDU. And women did influence BJP vote as well, but it was poverty, that it was the poor who basically drove the BJP back into a sort of...
And can you just mention the reasons or the historic reasons for the strong women's vote for the JDU in Bihar?
The data seems to suggest that it was the 15 years of RJD and the misrule and the kind of Gunda Raj and the kind of compulsions because of which even the Election Commission started mandating contestants to come out. All contestants needed to file criminal records. The number of cases that there were against them, they had to make this kind of information public. And it was that period of 15 years before 2005 that got reflected in some sense in that natural experiment of 2005. That in February, while no one got a majority, in the 6 months, nothing really transpired in terms of new policy because there was no government. And yet there was a huge surge in women voters across 36-37% of the constituencies, which led to a reversal, a complete change in the election outcome. And it's these 40% which led to consolidation of the JDU vote. Right? More and more women were coming out to defeat the RJD and bring Nitish in. That was the trend. And since then, JDU and Nitish in particular, they have, in fact, the first 6 months after they came into power, almost all their focus was on women voters. So whether it was the widow pension, the bicycle scheme, and subsequently election after election. And in fact, this is also reflected in a lot of the conversations we have, with the JDU leadership, is that for them, gender matters. They do want to represent what are aspirations of younger women of Bihar. So, and they continue to try and consolidate that vote. And I think they did it very successfully even in 2020. But again, poverty was the overriding factor. I think the reason this study, is particularly helpful and insightful for me is now, what is happening across India is that we are hearing words like welfareism, and we are hearing words that it's basically welfare economics, or it's basically all the social welfare schemes which are being targeted and done right and done aggressively in a pattern which is then leading to political gains, political gains to the incumbent government. And that, I think, is absolutely true. Now, we can think about what does it mean for the future? Where is growth going to come from? Is redistribution our only main agenda? Yes, those are, I think, longer term questions and conversations we should have. But definitely, the BJP is proving election after election. And this particular study definitely convinced me that they are able to target beneficiaries rather well. So the migrant population, when they returned to Bihar, the receipt of the cash on arrival at the train station, just better targeting through this. Within 2 weeks, they had already announced this excellent CoWIN, which is for vaccine. They had an alternate, I forget the name, but the Bihar government, the Indian government there created a very quick sort of online, a technical solution to targeting almost all migrant population. And the reward was there for us to see in the elections.
And I guess the ban on alcohol would also have been resonant for many women voters in Bihar.
Absolutely.
Oh, sorry, for women voters in Bihar.
Yeah. Yes. And that is why it continues to be such a popular policy.
Yeah. Okay, let's sort of go on to the big picture now, and the unique case of silent voters, the missing women in Indian democracy in a sort of larger context. I mean, one of the oddities about the first general election in India in 1950 and 51 was the fact that all women were able to vote, or all women over, I think it was 21 at that time, were able to vote, or it might even have been a little higher. While there were multiple democracies around the world where women could not vote, including places like France and some parts of Switzerland and so on. So India was sort of ahead of the game, and yet this thing of the low take-up, the low participation of women in senior positions in political parties, notwithstanding the fact that India had a woman prime minister way before many other countries, and of course the US has not yet got around to having a woman as president. One of the things that you mentioned previously when we spoke was the way that in parts of India where the sex ratios are particularly skewed, there are often more women participating in the political process, a sort of counterintuitive finding. Can you just speak a little bit about that?
If you don't mind, I'd like to share 2 slides just to give you a quick sense of how things, particularly since you started with the 50s. Look, Petra, this is how things are looking as far as electors, voter sex ratio in India is looking from the 70s onwards, which means that the gender divide as far as electors and voters is concerned has disappeared. There is no more gender divide. And this is a huge gain, especially because we're saying this is not an outcome of any specific policy followed by either the election commission or governments, right? Things have gotten better. There are better roads, better transport, it's safer today, etc. But this started very early on. This started even before T.N. Sheshan happened, or election commission underwent the EVM revolution and so on and so forth, which is why I repeatedly call this has been silent because it wasn't noticed. I think we should now stop calling it silent, at least because amongst us, we know that there's a complete resurgence and an acceptance of that resurgence. So the women voters are here and they're making a difference. But the fact that this gap has completely disappeared, and it started disappearing early on, is testament to the fact that we should call it a self-empowerment movement. This really, the silent revolution was one of self-empowerment by women voters. They really did it on their own. But, if you begin to look at beyond voters, the contestants, since you asked the question on voters, what is the likelihood of women contesting elections in India? And just look at the odds ratios from the 50s till 2 years back. If you consider the 1950s decade as the benchmark, the base year, it has increased 16.5 times. That's the kind of increase we have had in the odds of women contesting elections in India. So that is the kind of political participation, not just as voters, but women contesting. And what proportion of constituencies have at least one woman contestant? It used to be 7% in the 1950s. Today, it's more than half the constituencies we have women contestants. So that's an again, which is why I think when internationally, there are conversations about declining democracy, democracy under threat. Yes, there is an element to a lot of that globally, but in the Indian context, and especially if you see this from the prism of women in India, Indian democracy is looking stronger than it ever has. Because not only are the women coming out and voting, more women are contesting elections. And beyond contesting, now I want to take this to the second, here. If you look at, yes, women are contesting, but what are the odds of women winning? That has increased. It used to be, if 50s is the reference group of one, then, last 2 years, if you say, it has gone up 2.6 times. So while contesting likelihood has gone up 17 times, the winning likelihood has clearly not reflected that. And one reason is it is because many more women are contesting, which is good in itself, and it's a mark of political participation and so on. Women contesting and winning is not gone up that much. If you look at the odds of, if you control for more women contesting, then conditional on more women contesting, the odds of women winning has actually come down. So it's not happening at the same rate, and that needs a little bit of emphasizing. So this is what I showed you for, yes.
Would that be because they are being given unwinnable tickets, or for other reasons?
Now, the thing is, a lot of women are still contesting as independents, Patrick, which means not necessarily do they have political backing, meaning they don't have the machinery of parties to take care of the elections. That is number one. And number two, this is where I'd like to bring in that the third paper of political parties all have constitutions, their own constitutions, and they have a commitment to nurture women leaders and give them positions of leadership. But very few of them have come to meeting their own obligations to themselves. So they have constitutions that earmarks at 30%, 33%, but very few of them get there. And the last time when we had looked at inner party workings of how many positions of power were held by women, the party that came closest was the BJP, that they had a commitment of about 33% and 27% of their leadership position at that point was held by the women. And then we compared that with the All India Congress, or we compared that with the Communist Party, otherwise seemingly progressive, but not when it comes to giving leadership position to women. TMC is changing that, and you saw Biju Janata Dal definitely change that, because now increasingly they are giving more seats. So while most women are contesting as independents, just like most men, but that proportion is quite high for women. Right? Now, this is the graph, what I showed you for all India is very consistent for every state. Women are coming out and voting in large numbers, across the decades in every state of the union, and that's extremely, it's very exciting to see that. What proportion of constituencies have women contestants? More and more everywhere, right? Other than, of course, if you look at Nagaland, and it's a shame that Nagaland has not elected one woman MLA till date. Right, and that itself needs sort of underscoring that there's something wrong, that needs fixing. But every northeastern states typically have fewer women contestant compared to national average. That green line on top is the national average. What proportion of all India constituencies? But many states, if you look at MP, if you look at Karnataka, look at Delhi. If you look at Andhra Pradesh, Bihar, Chhattisgarh, all these states, Uttar Pradesh, they're all ahead of all India. So many, many more women are contesting. And that is where the paper you refer to, it's a paper which was titled, Why So Few Women in Politics? And there we had, we found in the data again, that in places where women are well represented in the population, meaning the sex ratio is very robust and in favor of women, there the likelihood of women contesting election is actually quite low. Whereas in parts of the country where sex ratio was poor, there women more likely to contest elections. So we have a nice model where we try and explain that it is very difficult for male contestants to ignore female voters in places like Kerala and Tamil Nadu, because there just are so many female voters that they are a very forceful sort of component aspect of the vote base. Whereas in a lot of the states where the sex ratio is a problem, meaning there is general neglect of women in the population, male contestants and leaders don't necessarily represent women voters. And that is why women seek representation by actively contesting, but of course they're not winning. And I think these are the two combined forces which lead to low representation of women overall. But I don't want you to, get these charts are, no, this is about just women. I can come back to this. This is about women, how much do they participate once they are in politics? We can come back.
I mean, if you were to take a punt predictively on where this is heading, if you go back to the 50s, generally the women in politics tended to come from elite families. So there were, people like Sarojini Naidu in the freedom movement, or Rajkumari Amrit Kaur as a health minister, or Vijayalakshmi Pandit, Prime Minister Nehru's sister, senior position, I think, as a
external affairs
governor, and before that as ambassador to the UN. Then there was a sort of wave of people who tended to, in some way, be connected to a man in politics, but not always. Sometimes they sort of came through entirely on their own. So I'm thinking of people like, let's say, Jayalalitha or Mayawati, Mamata Banerjee, Sonia Gandhi. There's a sort of certain type of prominent women in politics. And we seem to now be at a kind of different inflection point where the numbers are much higher. There are perhaps not so many big names, or big names connected to big names, but instead there's just a sort of far greater number. So where would you think that it may be heading, the kind of transition into larger numbers of women contesting, and the kind of women candidates who would sort of rise through into positions of real prominence in political parties?
So I do think the glass ceiling is very much intact. So we shouldn't kid ourselves that, yes, 17-fold increase in women contesting, but not that much of an increase in women winning. And therefore, the representation overall, if you see of 12%, 13% women MPs in the parliament, is an outcome which is fairly skewed. Now, one thing to note is that internal party workings are a great way for that pipeline of women leaders to emerge. So, in fact, one of the first public lectures I gave in Delhi in 2013, I think, was in the University of Chicago, the center which was set up, 2014 March. And the person who had come to listen and discuss later was Nirmala Sitharaman. And she basically, at the end of the event, she walked up to me and she said, Shamika, I am here because of the inner party workings of my party. I'm here because actively, and she vouched this for many other leaders who are now all prominent BJP women leaders. She said, we are here because women have been promoted as a policy within the party. One other anecdote I remember, one episode is, again, the same time I had presented this talk, the chief minister, the ex-former chief minister of Delhi, Sheila Dikshit, Sheila ji had called and said, you should come and present this to the All India Congress Committee. And because we do need these kind of reforms within the AICC, and we need more women representation and so on and so forth. So I think unless political parties work ways in which they can promote women leaders within their institutions. So I think we should try and think of what South Africa did, Patrick. It is not about giving quotas for women in parliament alone, which is going to solve the problem. And that is, other than Deve Gowda, it has been dormant, and we are seeing that a lot of political parties, namely, whether it was Samajwadi Party, the Shiva Sena, AIMIM, etc. There are many parties which vehemently oppose the women's bill even then. But it's not the quota in the parliament. Many times promoting women within political parties In South Africa, they basically give 50% of the tickets to women. So there are ways in which you can try and balance. But I think given that every political party has an inner party constitution which targets these progressive steps, I think they must be honest, and that might be the best way to do it. But what you mentioned, that earlier, many women used to be politically connected. And that is why, while we did have women as a prime minister, and we've had very powerful chief ministers, none of these women leaders have traditionally represented women interest. They are leaders.
Yeah.
And that is because that is how democracy works. That even if we were to assign and say, these are the constituencies which are defined women's quota, the women will still have to contest the elections and win in those constituencies. Now, as long as the voters, young male voters, are large in numbers and looking for jobs and have aspirations, political leaders are always going to represent average voters. And average voters, when all these leaders we talked about, whether it was Mrs. Gandhi, senior, whether it was Jayalalitha, Mayawati, etc., all their average voters are young men. So they represented the interests of young men, and nothing terribly women-centric. So we have to understand it from sort of the practical aspect of electoral politics.
It'd be because one of the things that I've noticed previously is I've always had an interest in what might be called losable seats rather than winnable seats, and the people who get selected for them. And one of the things that people from different minority communities in different political parties complain about is, I can get a ticket for sure, but I will never get a winnable seat. And it'll be interesting to see whether that extends to gender.
No, that I think is an excellent question, and we should definitely look at winning margins and what is a winnable seat, and who is a winnable candidate. We need, it requires a sort of a model where we can think of, what are the true costs in that sense, and the odds of winning certain constituencies, and whether women are being targeted. But for me, the fact that 70% of women contestants are independent itself is a great signal. It's telling you that it's against all odds. They don't have the machinery of a political party and the wherewithal to really support. So it's an extension of the same sort of story.
And would you? I think this may be my last question, because we've just crossed 5 p.m. and it'd be interesting to have questions and comments from others. But would you just explain the point about why states with particularly bad skewed sex ratios tend to have women in positions of political contestation?
So we have a model, a citizen candidate model, Patrick, where we try and explain that every individual is seeking political representation. And if we try and understand who is contesting and what representation they are seeking from the point of view of gender. So if you think of gender as a continuum 0-1, the average voter in places where you have skewed sex ratio, women are never going to be the average voter in these places. So whoever wins is not going to represent their interest, right? Which is why contesting elections, which is a much more costly way of seeking representation, rather than going out in hordes and campaigning and getting politicians to listen, right? Which is what a lot of the developed parts of our country, they do. In fact, what Bihar is now doing, you don't necessarily JDU responding to women's interests, or increasingly, I think the BJP is trying to do that. Prime Minister Modi's campaigns, if you begin to look at them, increasing the LPG scheme, whether you look at Swachh Bharat, the toilet scheme, none of them started out as women-centric policy. They're just progressive policies. Cleaner energy is just better hygiene, open defecation has huge health problems, etc. But they all disproportionately impact women more. And I think the recognition of a lot of the truth of that public policy is helping consolidate women, by the BJP, similar to what the JDU did in the past election. So I think when women come out and vote in large numbers and vote for certain things, whether it is, development and toilets or pension scheme or anti-alcohol, etc., political parties respond. They are responding to that. But in areas where now, when you start thinking of your own local constituencies, if you have, not enough women are, they aren't powerful. It's a hugely unequal constituency, even in terms of just the general population and women coming out and participating in political sort of space. There, the only way women can really seek representation is by contesting and losing, because they don't win from those constituencies. And I think that is the sort of the irony of it all, that they're willing to bear the additional cost. Because in those places where the sex ratios are highly skewed, the parties that are winning a lot of these constituencies are very male-centric. And that is why we are also seeing that after 5 years, or after now 15 years, why RJD found it so difficult. Despite unemployment and despite a very spirited campaign, the RJD found it very difficult to displace the NDA in the midst of a pandemic, is because, I think memory is not that short. Women, and especially security, safety matters. And I think there is an element of truth to that when you look at the UP elections as well, that the Samajwadi Party, despite Akhilesh's efforts and investments in roads and campaign and etc., women have long memories, and safety is a very important issue. And if you just look at the data of rapes and crime against women, etc., you are seeing that there is a decline in UP in the last 5-6 years. There is and women are responding, and political parties are therefore responding in turn. So I think that paper, of course, has a cute theory to it, and I urge anyone interested to pick it up and read it. But there's a lot of reality and data sense which sort of reinforce what we're saying there.
Thank you. Okay, let's now move to audience questions. I know a lot of economics faculty here may have things to say. Should I hand back to you, Sudhir? What do you do? Do you unmute the questioners, or how does it work?
Yeah, so there are two questions where I have requested them. They have agreed to come on camera, so I would like to invite them.
Okay, great.
Yeah. So Mayur, if you can come on camera and ask a question.
Sure. Hello. I hope I'm audible.
Yes, you are.
Thank you. It was a fascinating webinar, if I say. I particularly liked the way methiness of economics versus philosophy of economics was talked about. I am from Indian Institute of Public Health, Gandhinagar, so my primary interest is in health. So my first question was when the speaker talked about AIMS story, which was a facility-based study. And how does that connect to population-based sample? And while I was typing, it was already talked about. But connecting question is, now that we have what is called Pradhan Mantri Jan Arogya Yojana, which has open enrollment, unlike the Rashtriya Swasthya Bima Yojana, which had a selection of 5 members per family and which had gender role to play. How this seems to be changing with PMJY-like schemes where the women may have equal or better opportunities to get enrolled and seek financial protection, especially because referral to AIMS-like institution may end up in hospitalization, for which the scheme is for.
So should I do a question at a time? I think that might be better.
Yeah.
No, Mayur, thank you for that question. One thing is that what I am trying to encourage and sort of do is we have to now start looking at what impact Ayushman Bharat and Jan Arogya, these large schemes are having. But while we have not seen any systematic assessment of what impact it is having or the role of gender in that. We do have research from India, from not very far, long back, about 10-15 years back, 2009, so about 13 years back, we had done an assessment of a micro health insurance program running in almost 100 districts across the country by one of the larger microfinance institutions. And we found there that because health insurance was tied to loan, the family was covered. So it is more like the Jan Arogya, therefore it's not people going, you are covered, but there is a systematic gap or a bias in terms of filing claims.
Mm-hmm.
Now, which is again, financially, it is almost irrational. It is irresponsible that if you are paying the price for it, why are you not filing claim? So the question then, when you dig into the data further, we found that women, when they were borrowers of the loan, they were very likely to use health insurance and file claims. So they were financially much more aware. But women who were covered as spouses of borrowers, so they weren't themselves going into the meetings, or they lacked the kind of awareness that women borrowers have. So, as active borrowers of microfinance loans, there's a lot of financial literacy and awareness, etc., that comes with the loan. So they know what has to be done. So when they fall sick, perhaps someone is telling them, you can go and get hospitalized and get help for this. So many more women as borrowers are filing claims, while women as spouses of borrowers are not filing claims. So there is again a systematic bias there. Totally irrational if we look at it economically, that you're filing the claim, you're filing the cost, so you're covered, but you're not filing claims. Why would you forego such a benefit? Well, that is what it gets into the whole health seeking part of it, that who decides who goes to hospital in the household. And there is sociology literature which points to women decision whether of women's health seeking is often done by either the husband or the mother-in-law. So there is research to show that, but this microfinance study very clearly showed us that women as spouses are clearly uninformed. They don't know, and they're not aware. And that paper is called "Do Spouses Make Claims?" It's a World Development paper. And I think it is, it sort of gives us an insight into health-seeking behavior. So it's not just coverage. And what we have done in Ayushman right now is we have extended coverage. It's a very generous coverage. But now it's time to go in and look at who's finally benefiting from it and if there is a gender aspect to this.
Yeah, thank you.
Thank you, Mayur. Now I would like to invite Shruti to ask a question. Shruti, if you can.
Hi, am I audible?
Yes.
So this was an amazing round where I discovered a few new things, and my educational background is I'm just a graduate, and my opinion represents the opinion of a fairly aware, politically aware person in the society. My point being, I'll just try to explain. Recently, a lot of channels or a lot of media attention goes to women politicians who are highly opinionated. And I've seen a lot of being Supriya Sule or Mahua Moitra. So these people get a lot of attention for being opinionated, and I see them as strong. And a lot of people around me who are like me see them as strong just for being opinionated. However, that doesn't play well being a woman politician where diplomacy works better. Being highly opinionated goes against the very the diplomatic part, the survival part of being in the political system. So is that firstly, is that the reason why women are still just giving opinions, even if it has come to a good degree of strong opinions, but we are still not we still do not have a decisive vote. So if that is the reason, could that be a reason, or am there some other causes that I am missing out?
All right, Shruti, for that question, I'm going to show you this data. I thought we might never get to this. You know what this data tells you? It's basically, it's showing how many questions are asked by women MPs in the parliament. So it's one thing to get into the parliament, but are you asking questions, and are women faring differently from men? And is there systematic difference across political parties? So in some sense, now it is actual effectiveness of women leaders, right, in the parliament. Now the left plot is of the 15th Lok Sabha, so 9 to 14, and the right one is 16, so Lok Sabha, which is 2014 to 19, so closer to what we have right now. So this is not the current, but first, the left plot is showing that the NDA, which is largely BJP, the women are talking more than the men when in opposition. But very interestingly, The right plot shows exactly the same thing, that the BJP women politicians are talking more than all others, meaning they're asking questions to their own government, much more than the men within the BJP or men and women of the opposition.
Right, right.
So to me, this is an excellent, to me, these are the kind of insights which tell me what is true empowerment. Strength in numbers are there, but qualitatively, once you're in the parliament, what is your voice? And what you refer to, this is now the 16th Lok Sabha, 2014 to 19. If you look at UPA female MPs and the questions they ask, there are 2 dots. First of all, there are very few dots in that gray, very few questions, right? But there is one person who asks a lot of questions. So there is a one tiny dot on top. And then there is one tiny dot at the bottom. And the one at the bottom is actually Mrs. Gandhi. She didn't ask a single question. And I think there is some reversal of that. Now she's
Wow.
and what you see on top, I suspect that is Mahua Maitra. Now, I don't know, you'll have to go back. This is all anonymized data, but this is public data. You can make a reference to this. But these are true mark of women representing women's interests. Now, Patrick, this goes to the earlier question, because you also know what questions they are asking. What are the ministries that they are asking questions to? The women MPs are almost always asking questions on health, education, safety, water, right? These are core issues, and these are core public good issues that come into relevance when you go to the elections. So I think your question is spot on. Though the role for diplomacy and diplomacy necessarily being better for female political representatives, I'm not so sure. It's good to be diplomatic within the parties and closed door, I suppose, not making any value judgment there. But when you're in the parliament, you're there to represent your constituents. And if you don't talk, then I think you are failing your people.
Another thought on the question as well is, I'm not sure whether the people you mentioned in the question, like Mahua Moitra, would she be seen as especially opinionated if that was a male politician making similar points? I think there's a very high cost for, younger women, particularly going into politics. The level of abuse that they get on social media is certainly greater than the amount that comes at men. There's an expectation that they should behave in certain ways. And if they ever step out of line in the smallest way, it's immediately grabbed and they're lectured about it. So, I would agree with what Shamika said, that, yes, you can be diplomatic in the way that you conduct yourself with colleagues, but unless you're outspoken, you're not doing your job as a politician, whatever party you're in. You have to say your views, regardless of whether, whatever your gender is.
Just making a tiny point here, but what I've seen is male candidates making genuine points, giving opinions, strong opinions about any part of India, or genuine progress. How many men do we see who are advertised or who are put in the media because of that reason? And how many women who we see, like, there's a bar or a scanner under which women who give high opinions, like very strong positive or negative opinions, they get to have media exposure, they get to have that place in the media, but not the case, not the same case for men. Go ahead, Patrick. Sorry.
Yeah, no, this is interesting. Another point. So when I used to talk about politics on TV, quite often on English language news channels in India, which is something I was doing about sort of 10 years ago quite frequently, I would often complain to the bookers and the managers, why are you having yet another all-male panel? Or, why is it that there are 6 people on the panel and 5 of them are men? And the issue that they raised is that a lot of women in public life, whether they're working in public policy or think tanks, or they're politicians or they're writers, they do not want to go onto the media because they don't want to be shouted at and shouted down and deal with the kind of feedback loop that you get through social media. So they said, we're always trying to book people, like X name, Y name, Z name, but unfortunately she doesn't want to do it. So I think, those costs are very high, and they're probably even higher today than 10 years ago.
Understood. It was a. By the way, Miss Shamika Ravi, can I get that slide if it's possible? Because that was more insightful than what I have seen. A lot of things I've seen across in the past month. That particular slide.
Or the number of questions asked?
Yeah, that one. Do you mind if I
Sure.
take a screenshot?
Happy to share it. Happy to share it. But Shruti, if you do a Google search, almost everything that I showed you today is publicly available.
Yeah.
I have shared this in the past in some form or the other. But if you don't get, just let me know. I'll send it to you.
Oh, perfect.
Otherwise,
Thank you.
we also share the recording, which is available. So you can
Perfect. Thank you. Thanks a lot.
Now, I would like to invite Professor Sonal Yadav to ask a question.
Yes, very interesting conversation, Shamika and Patrick. So my question is at particularly at rural level. When you see in panchayat, we know that women have started occupying seats of power in panchayat, but most of the decisions are taken by their husbands. This is I have actually experienced this because when we went to Kutch for one survey on demonetization, we wanted to ask some women sarpanch or sarpanch in a village, and what we found was we met their husbands only. We couldn't meet women, and at one or two places we met women, but women were sitting on the floor while husbands were sitting on sofa and answering all the questions on behalf of women. So still, on one hand, we see that, okay, women are at the top positions or they are sarpanch, but their role actually is not, that very good. What's your opinion on this?
So there is research actually on in fact, India's experimentation with quotas or a reservation for women in political positions. It started with the sarpanch position, where eventually 50% of panchayats were earmarked. And there was a study which basically found there to be a positive impact. That when the sarpanch was women, there were better outcomes. But then when that, and this was by Esther and I think Abhijit and a group of people, but when the data was extended over a larger geography and over a longer time frame by I think Pranab Mardhan and his team, they found that there was no significant impact. Now, I tend to believe in the second, and I'll tell you why. That we are not giving, or the idea of reserving seats for women is not because they will necessarily make better leaders, right? It is more a question of equality of opportunity. So make the cost similar. To put women on pedestals, I mean, if we necessarily knew that women are going to be excellent leaders and much better than men, which is why I often find this conversation around management of COVID and women leaders have managed it better and so forth. I mean, a lot of it is, I think, make believe, and we like the idea. It's a highly romantic idea to believe. But I think men and women on an average are sort of similar. There are some differences when it comes to what they might prioritize as far as public goods are concerned. So for instance, the earlier reference to safety, to women asking questions about health, education, etc. Yes, there is a definite focus to what they're doing. But Pranab Mardhan's study clearly shows that there is no huge difference in the performance of the panchayat, whether the head was a male or a female. But, I think, but the problem is also structural, Sonal. Remember, the 5 years is not a long enough period to transform a panchayat.
Right.
I mean, these leaders do have powers, but 5 years, and after that, remember, it's rotation. Meaning, it doesn't remain, let's say, even if you are a good leader, it doesn't mean you will necessarily, because in the next period, it becomes open and so on and so forth. So I think a lot of these studies, we do need to constantly keep evaluating and get a better sense of what the women are doing. But the corporate finance literature, I think, has something to educate us there. When some of the Scandinavian countries, and I think it was Sweden, that started with overnight raising the number of directors on a board. It went from 4% to 40% overnight, because that was the legislation, that 40% board membership should now go to women. the performance of the firms, if you look at firm data, then the share price didn't really show a big difference. Means overall financial performance was the same, but definite governance indices began to show some difference, meaning the meetings were held on times, they were minuted, the CEO compensation was better tied to performance of the firm. And these are all metrics which give you a sense of better governance. So the question we are asking is even if the financial outcome doesn't vary, do we value governance for itself? And therefore, right? So you get into the whole case of what is the price for good governance. And the second is, it's not because women are necessarily better leaders. The whole conversation around panchayats and reservations, etc., is equality of opportunity. So it's really making the costs similar. And the cost of entering public life, it is not just the cost of campaigning. It's to the point that Patrick alluded to earlier, that because women have traditionally not been part of public life, the real cost is not just monetary. It's just the the inhibitions and the social norms and the kind of baggage that you have to overcome to truly become a public figure. That is costlier for women. So in that sense, coming up with these progressive policies are really baby steps towards it.
Right. Thank you so much.
I also, Sonal, I wondered whether if you did a kind of a similar interaction, it was in Kutch, right, that you were talking about.
Yes.
If you did that in different parts of India, if you did that in South India, if you did it in West Bengal, even if you did it in, let's say, Bihar, would the experience be the same? I mean, for sure, you do get those situations which are very difficult if you're trying to interview people where somebody is answering on behalf of someone else, and particularly answering on behalf of the wife. But I mean, take for example the case of Bihar and the eclipse of Lalu Yadav, Rabbi Devi becoming chief minister, being ridiculed by journalists because she didn't know the answers to questions. But then look at someone like Misa Bharti, the daughter of the two of them. I remember interviewing her again. This must be about 8 or 10 years ago. There's a major generational shift in the way that women talk about politics. If you sort of look just in one generation of change. So, I mean, I may be a little less pessimistic on this.
No, but also, Patrick, to be more pragmatic, remember that even if the outcomes aren't that different, and even, for instance, earlier when you said women mostly entering politics were politically connected, and that is, by the way, happening in many countries where they do have reservations. And many countries do have 30%, 25%. Pakistan has, many even of our neighbors have. What it does do is that it begins to create a pipeline of women leaders. Because it is okay, right? So they might not have done a lot for women in general, but what it does do is it is acceptable to see women in political positions. It just lowers the perception, the cost and the barriers to entry that exists in society. So creation of a pipeline of women leaders is what we are working towards.
Absolutely.
Misa Bharti example is an example.
And an increasingly educated pipeline, let's say, of future leaders.
Yes, thank you so much. Now I would like to invite Professor G. Munundi to ask a question.
Hi, Shamika.
Hi, how are you, Jimo?
I'm fine, thanks. I really enjoyed your, the length and breadth of the research that you have done. With this, even, having a common theme. I can see that, I'd like to call you a feminist economist in the sense of having that focus on gender, no matter what you are, what you might be researching on. So I think that was really quite a fascinating talk. So what I wanted to say was that if we look at, in terms of the what you were talking about and some of the other stuff which is there out there, you look at the gender gaps. Okay, so if we look at the education gender gaps, they have closed. I'm talking about India, but of course in many other countries they seem to be closing. The political, you showed a very great, very interesting differences that participating in the political process of actually voting or even participating wherever they have reservations and so on in contesting is there, but when it comes to winning or then speaking up in parliament and so on, and then it's not there. But then when it comes to health and work, which I think are two very, very important indicators of women's status, we know that there's a huge gap in the participation, both in work and in the health. And the health thing, you brought out extremely insightful data from the All India Medical Institute. But, this is something that we know that why women are not reporting health, why they are not. So there is this very much broader reason for that, which I would call it social norms. They call it patriarchy. But basically, it is that particular. There's that one elephant in the room, so to say. Whether you talk about education, health, politics, or whatever, it's there. But when you were, and you pointed out very interestingly that the social norm, you were putting it very nicely, that there is a role for the family and the community, which is much larger than just for the government in terms of overcoming some of these kind of gender gaps, if I just call them gender gaps. So you began with talking about different types of disciplines and the kind of research they do and the kind of outcomes they. So to arrive at, to think in terms of research, which could address and also solutions, because it's not necessarily policy solutions, something else one needs to do. And we as researchers, I address, there's a roundtable on women empowerment in some conference, and I'm there and I raise this issue that, we talk about everything, give them finance, give them, the market participation, the political participation. But what are you going to do with that thing called social norms? So is there some, which branch, say in economics, micro, macro, you said macro doesn't address this, or that behavioral thing, which is experimental stuff, or is it sociology, anthropology? Which discipline or a combination of disciplines do you think would help us to find something that we can, slowly hit on? I don't expect anything to change immediately on the issue of social norms, which then affect all these various gender gaps.
Oh, Jimol, what a great question. Well, first of all, I'll tell you, I try and stay away from labels. As economists dealing with policy, more than half your battles are about telling people that this is core economics. That economic policy is not when you only deal with inflation, fiscal deficit, and 3-4 macro indicators. Macro indicators is a very limited part of dealing with economy. All these issues, when you're dealing with labor policies, gender policy, health policy, education policies, labor, these are fundamental core aspects of economic policy that we are trying to get a sense of. But I'm glad you highlighted one key aspect, which of course, perhaps it wasn't within the purview of what we were going to talk about today, but it's important to highlight that we are the only country, and therefore it's truly idiosyncratic, that with economic growth, we are seeing declining female labor force participation. There are many feudal, hierarchical, traditional societies like China, South Korea, Japan, and yet they have been able to circumvent, they have overcome this problem with economic growth, and they have seen rising female participation. So what is it about us? It's like solving a puzzle. So one piece of research which I think comes closest, of course, there's no universal truth. We do need a lot more surveys, Jimon. I think we need a lot more surveys to respond to some of these true enigmas. That overall wise labor force participation rate so low in India, barely 50%. Even Bangladesh has close to 60%. Vietnam 70%, China 75% for 30 years. Peculiarities of Indian economy, and especially labor markets, we need to unravel, and this cannot remain an enigma. So I think that is our sort of job, and we have to, of course, we don't have enough support because we are all individual scholars and researchers trying to address, but I think as a community, it does fall on us. We have to address, number one. Number two, that piece of research which does come closest was something came out of the University of Michigan a few years back from a PhD dissertation. And the student, what she had done was she estimated the labor supply, the elasticity of labor supply of women to husbands' wages. And what she showed is that when husbands' wages were rising, women's labor force participation fell. Now, by the way, this is something you see in very affluent parts of the world, very rich areas that the wives of CEOs, etc., choose to sit back. But for an economy which is $2,100 per capita per year, we are too poor to say that women are choosing to stay back because husbands are earning more. I think it's not as much a choice as the fact that as a traditional society, we want children. We put a great weightage on family, but the cost of bearing children is disproportionately borne by women. So they might be going out and getting the education and the skill and all of that, but the minute the baby arrives, she is the sole person responsible. There is a nuclearizing and therefore breakup of joint family structure. We clearly are not replacing that broken sort of joint family structure with anything institutional. The concept of daycare, even within industry, I think the responsibility is also of the corporate sector, right? Any organized firm or institution which has women, more than X number, we can set that price, needs to provide daycare facilities, needs to provide and make it feasible for women to carry out working when they have children. So we did raise the maternity leave from 3 months to 6 months. But I think, again, we have to be pragmatic and say that perhaps it's too high a cost for a low-income country. What did most firms do? They substituted away. The Team Lee survey came out and very clearly showed us that 6 months is too, meaning you're asking the firms to pay for half the year's salary in a market where they're easy to substitute. They'll just get a man to do the job. So you see, there are subtle ways in which markets sort of work their way around these costs. So I think you're right. I think these are very difficult questions, but as a society which values children, and we need to find institutional and therefore a public policy response to it. It is not just maternity leave. We have to think of either institution or daycare facilities locally available within all RWA. I don't know. We'll have to think of these. These are experiments. But the, sort of an extension of some of that also has to do with the fact that, public policy, a lot of it, there are very few women, I think, generally representing a lot of these interests, Jimol. Finding adequate representation for a lot of these problems, whether that is truly a first order problem or is it something esoteric and academic and therefore not a mainstream problem, is often our concern. That how do we mainstream some of these issues? How do we prioritize and put them higher on the sort of the pecking order?
I should maybe mention just before we close that the questioner, my colleague, Professor Jimol Uni, was recently invited to become the conference president of the 63rd Labour Economics Conference of the Indian Society of Labour Economics. So a quick shout out to you, Jimol.
That's great.
I think, Sudhir, is that probably the last question?
That was the last question. So I would request you to kind of close this with your closing remark.
Oh, okay. So my closing remarks really are just to say a very big thank you to Dr. Shamika Ravi for participating in the conversation series at Ahmedabad University's, I was about to say School of Arts and Sciences. Let me correct myself, the Amrit Modi School of Management. And thank you very much to everybody who participated this afternoon. Just for historical memory, I think that everybody is surrounded by 44 degrees centigrade of heat. So that's where we're at in 2022. And let's talk climate in the future, which was a subject I wanted to bring in, but didn't quite manage. So let me just hand back briefly to Shamika to make a closing remark, and then I think we can finish.
Thank you, Patrick. Thank you, Sudhir. Thank you, everyone. One thing to note again, as an economist, we try and measure everything, but clearly a lot of our measurements are wrong. And they're inadequate. They're just not sufficient. And I think the gender and the GDP and women's role in an economy and what they bring to the table, I think is highly underestimated. And in simple terms, of course, we were talking about women responsibility in the household and raising kids and etc. These are very labor intensive jobs. And because these are not monetized and none of the chores which women carry out is counted as a part of the GDP, clearly we are also undercounting. And that itself is leading to, I think, it's a distortion of the way we think the world ought to be. Perhaps the world is working its balance out quite well. It's in the measurement of things that we are falling flat, and therefore some problems seem much greater. But definitely, we have to do a far better job of finding women's value, I think, in modern society and economy. But once again, Patrick, thank you so much. Thank you to the university and the management school. Sudhir, thank you very much for organizing this. Thank you all.
Thank you so much. Professor Jimol's battery ran out, so she's just said thanks to everyone because she just went out of the Zoom meeting. But thanks a lot, and I must really say that I really liked the opening, the way the opening was of this conversation that answered several questions, and that was very interesting. So thank you so much for doing this, both Professor Shamika Ravi and Professor Patrick French. We are grateful to you, to the entire this thing. And we are also grateful to the people, those who have joined on Saturday, on this hot Saturday afternoon. And everyone, please take care. Thank you so much.
Thank you, Sudhir. Okay. Bye, Shamika.